of this week's vote, what do you see as the next step for the Conservative Party in terms of repealing the health care bill or replacing it?
I think there are a number of steps that we have to take. One, we've got to be just as aggressive as we can in supporting those individuals that are contesting this bill based upon constitutional grounds. I think, as I know many individuals do, that there are many aspects of this bill that are unconstitutional. So whether it's the individual mandate, the government telling people what they must purchase, or the different treatment of union members who have health care coverage and non-union members, I think those kinds of things are probably unconstitutional. And so we've got to support folks that are contesting that. Secondly, we've got to identify all of the awful things that are in this bill that have real consequences in individuals' lives every single day. So when jobs are destroyed because of this bill, or individuals can't make independent health care decisions, or doctors leave the practice of medicine, those things have to be pointed out. And then we need to work toward empowering patients and repealing the egregious aspects of this bill and replacing it with common sense kinds of things, things that, again, put patients in charge of their health care. And then finally, we've got to work toward November and make certain that we get a Republican majority in the House of Representatives, or a conservative majority in the House of Representatives that understands and appreciates that we've got to have fundamental American principles followed and puts appropriate checks and balances here in Washington.
Is there any way that the RSC's proposal, the patient-centered approach, could be the replacement for what's in place right now before the elections in November?
Well, there's certainly proposals to do that. In fact, one member of the Republican Study Committee has already introduced a bill, or has written a bill that repeals the awful government takeover portions of the bill and replaces it with H.R. 3400, the Empower Patients First Act. So we can introduce it, but it would require the Speaker to allow it to come to the floor, and Speaker Pelosi isn't going to do something that would make that kind of sense.
Coming from a medical background, what do you think are the most devastating portions of the bill in terms of patients and for doctors?
Yeah, there are three big things that I think are just awful in the bill, and that I believe violate that fundamental American principle. The first is the government program, the government option, the exchanges, whatever you want to call it. All of it is the government dictating what kind of coverage people will have. The second is the individual mandate, saying that you have to purchase this. Each and every American citizen having the federal government under punishment, under penalty of law, you got to purchase this kind of health coverage. That's just not a fundamental American principle that's being followed, and as I mentioned, I think it's probably unconstitutional. And then third and finally is the huge issue as a physician that we are ceding, we are giving the federal government the ability to decide what quality care is. And when you do that, that means that the definition and what kind of care you and your family receive and every single American receives will be determined by folks in Washington, not patients and families and doctors. And we believe that patients and families and doctors ought to be making those decisions. They trust government, we trust people.
How has the media response to the bill helped or hindered the Republican position?
Well, I think the media has helped greatly in bringing attention to the legislation. Remember, the original plan was to pass these things last July. So the fact that here we are in March of 2010 and just having gotten them to the floor for final passage is a huge victory for the American people, because they said, look, stop this madness. We don't want this kind of thing. And the media has been able to help in that way. I think the media, however, has difficulty focusing on issues for a prolonged period of time where they're actually educating folks about the specifics of the legislation. And that's kind of the nature of the media itself. It moves very, very rapidly. But I think what they did, though, is bring focus to the bill so that the American people could actually know what's in it. But one of the awful things about this is that the enforcement arm, the folks that Speaker Pelosi and Senator Reid and President Obama believe ought to be enforcing and making certain that you and your family and everybody across this land purchase the kind of health coverage that they want you to purchase and that they will force you to purchase. Who's going to enforce that is the IRS, the Internal Revenue Service. And so they're going to hire 16,000 or more new agents, new IRS agents, to look at your tax return, make certain that you're documenting exactly the kind of health coverage that you have. And if you're not, then the penalty will come through the tax arm of the federal government. It's that kind of reach, it's that kind of oppression of the federal government that gets into people's lives that I believe has ignited the American people in a very positive way to say, look, we want checks and balances in Washington, this isn't what we want, and we want to move forward in a positive direction for patients.
Okay, thank you.
Thank you so much.